Hello student, today we are going to learn about pathogenesis of diabetes mellitus, that is part 3. The pathogenesis of diabetes mellitus can be explained as follows. Type 1 diabetes mellitus, formerly known as insulin dependent diabetes mellitus IDDM. This type consists of type A and B, which can be explained as type 1A immune mediated diabetes mellitus. This type of diabetes occurs due to destruction of beta cells which are present within the islets of Langerhans in pancreas by the autoantibodies produced against them. The autoantibodies are formed against islet cells and insulin, glutamic acid decarboxylase and tyrosine phosphatase islets antigens. Since the beta cells are destroyed, insulin is not secreted. Interplay of the following three mechanisms is responsible for the destruction of islet cells. First factor, that is genetic susceptibility. Class 2 MHC, that is major histocompatibility complex, linked genes, and non-MHC, that is linked genes, are responsible for protection of beta cells against destruction. When these genes are altered or mutated, an abnormal immunological response occurs and the immunity conferred by them is hampered. Second factor, that is autoimmunity. An immunity of a person and its role in destruction of beta cells by production of autoantibody plays a role. Third factor, that is environmental factor. Though the environmental factor have not been clearly defined in the causation of diabetes, they mediate the destruction of beta cells by modifying the autoimmunity. Factors like presence of viral infection, geographical and seasonal variation, and exposure to certain chemicals like alloxin, etc. have been considered to trigger this disorder. Second type, that is type 1B idiopathic diabetes mellitus. This type of diabetes mellitus has no known etiology. These patients show no evidence of autoimmunity as they test negative for autoimmune markers. However, there is insulin deficiency in these patients. Second major factor, that is type 2 diabetes mellitus, formerly known as non-insulin dependent diabetes mellitus NIDDM. This type is characterized by either impaired insulin secretion, a delay in insulin secretion compared to the glucose load, or insulin resistance, that is peripheral tissues are unable to respond to insulin, though the beta cells are either not destructed at all or if so are moderately destructed. Interplay of genetic factors and constitutional factors bring about this type of diabetes mellitus. Genetic factors in this, in case either of parents are diabetic, the offspring has an increased chance of getting diabetes. However, if both the parents have type 2 diabetes mellitus, the chances of offspring getting this disorder increases to 40%. Second, environmental factors. Certain environmental factors like obesity, physical inactivity and hypertension contribute in the occurrence of this disorder. Thank you.